Christina, thank you for joining us from Long Beach, and Kristen, great to hear that. And I know you're representing from California as well, so I think California is well represented. So thanks for joining. All right, well, I think we are at 3 o'clock. So I will go ahead and kick us off, and then if others join, we will welcome them as well. So good afternoon, everyone. We are so happy to be with you all today, and we continue to hear from all of you that things are really tough right now with back to school, obviously more and more children testing positive for COVID, just a lot going on in your sites. And so I think we all want to honor this up front and thank you more than usual for joining us today. My name is Jennifer Tracy. I'm the Senior Director of Growth and Sustainability for the HealthySteps National Office, and I will be facilitating our webinar today. And as folks trickle in, we love to know more about who's in the room. So if you don't mind, you can put your name in the chat, where you're logging in from, and maybe a word to describe how you're feeling. So I'll go ahead and model that verbally. My name's Jennifer. I'm calling in from Virginia today, and I'm feeling overjoyed because this has really been many years in the making, and we're so excited to share the product of this hard work with all of you. There are many people from the network here and others that will be joining, so thank you again for spending your afternoon with us. Before we start our conversation, I want to say please accept our apologies for scheduling this webinar during Yom Kippur. And please note that this conversation is going to be recorded. It will be posted on our website for future reference. So if you have colleagues that were unable to join, or if you can only join for a portion of today, please feel free to revisit the webinar that will be posted on our website. We do invite you to send in your questions throughout our discussion today, and we have also held time at the end for questions. And of course, you can feel free to post any questions you might have using the Q&A feature in the toolbox at the bottom of your screen. We also encourage you to share your thoughts and reactions using the chat box, so whatever is easiest for you. And with that, let's get started. So today, we are going to start out with some introductions. We'll then provide a history of the HealthySteps business case and ROI Calculator, followed by a demonstration of the new tool, and then we'll review some of the supporting materials that will be available to all of you. We will then have a panel question and answer session to discuss sites' experiences to date with the HealthySteps business case. Then it will be your time to ask our panel questions, and finally we will open it up for a larger question and answer session. So today I'm joined by several panelists with HealthySteps business case experience, and I'm super excited to introduce you to them. First of all, we have Sharon Woda, who's the Managing Director with Manat Health, Quinn Kaiser, who is a business analyst with our HealthySteps National Office, Elizabeth Frenette, who is a Senior Policy Analyst with our HealthySteps National Office. And then from our sites, we have Sarah Nolan, who is the HealthySteps Program Director for Rady Children's Hospital in San Diego, Melissa Buckholtz, who is a licensed clinical psychologist and associate professor at the University of Colorado School of Medicine in the departments of psychiatry and pediatrics. And then we have Deanne Davies, who is the director of early childhood outreach in pediatric psychology at Summit Healthcare. We are so excited to launch our new online ROI calculator. And as I mentioned, it's really been years in the making. And we are grateful to our funder, the Valhalla Foundation, for helping to really bring our dream and our vision to fruition. I want to say again, this time is for all of you, so there will be plenty of opportunities for questions. And if we don't get to your question, we'll be sure to follow up later. And I really want to kick us off by answering the question, what is the HealthySteps business case? In short, HealthySteps is a low-cost intervention that actually saves Medicaid agencies money. And we all know that healthcare costs are high in our country, so a way to save money that is also good for families is a win-win. I know that we are all committed to serving children with Medicaid health coverage, and we're committed to explicitly addressing and closing health equity gaps. And because of you and your work with children and their caregivers, HealthySteps drives significant Medicaid cost savings, even when evaluated against a short 12-month time horizon. So again, really important for everybody to note, just within a 12-month period, HealthySteps can generate short-term cost savings for Medicaid. The HealthySteps business case demonstrates the value of your work and the HealthySteps program to your state Medicaid agency, major payers such as health plans and insurers, and also your health system. And we know that not every HealthySteps specialist can bill for the services that they provide to children and families based on their credentialing, licensing, a whole host of things. And so the ROI Calculator is really a tool that you can use to demonstrate your impacts and value beyond billing. So why is the HealthySteps business case important? It really allows HealthySteps specialists to do a number of things. First of all, it allows you to put an actual dollar amount on your costs saved each year. It also allows you to highlight the importance of providing early preventive services to babies and their caregivers. It demonstrates the value add and outcomes of HealthySteps to payers and funders, even philanthropic funders. It also helps to educate stakeholders beyond state Medicaid agencies that HealthySteps is a smart investment for healthcare providers and systems in the short and long term. And it positions HealthySteps to pursue long-term sustainable funding, which I know we are all always laser focused on. And key to all of these things are data. Most importantly, the main source of data for the HealthySteps business case is our new ROI, or return on investment calculator, that we're excited to share with you. The online tool is designed to help you understand how the HealthySteps services you provide to children and their caregivers can save Medicaid money in the short term, and invite your Medicaid agency and other payers to discuss sustainable ways to fund HealthySteps. So you can actually use this calculator to input your data, generate a short-term 12-month return on investment estimate. We have done this before at the state, health system, and site levels using this method, and have shown an average ROI of about 163%. So that means that for every dollar invested in HealthySteps, an estimated $2.63 in savings is realized by state Medicaid agencies each year. So that's pretty significant. And again, I think something that as each of you get into the ROI calculator, input your data, it will be really, really exciting to see how that number changes. Now I'd like to welcome Managing Partner with Manat Health, Sharon Woda, to share a few words with you all about the history of the ROI calculator. Sharon?
Thank you, Jen. In late 2015, a select number of the HealthySteps site had lost their funding and really needed to turn to state Medicaid agencies. They'd lost their federal funding stream and needed to look at states for sustainability strategies. And that's where we came into play. We're a strategy and consulting firm. We wear many hats. We work a lot with providers, but notably we do a lot of work in state Medicaid and have real deep expertise in state Medicaid, and specifically looking at developing solutions to, some of the most pressing policy issues. And one of those has been and continues to be solutions for how to just better care for and treat children, and not ensure that children don't lose the focus with the midst of all the chronic condition focus that happens. One of the things we know really heavily from working in states and with state Medicaid agencies is they're often short-staffed. There's some turnover, and they just have so many priorities on their plate, in particular now in times of COVID, but they've always had a lot of priorities on their plate. And quite frankly, they don't always have time to connect the dots and on a particular care model or a good idea. They get lots of good ideas that are brought to them and lots of things that they can verbally support, but really trying to think about things that they fund is sort of a different bar, and to get that level of attention from them is a different hurdle to take. So approaching agencies with a clear and quantifiable value proposition can really advance the conversation with that state. And in the case of HealthySteps, you're able to now demonstrate the value of the interventions that you provide to young kids, and everyone sort of knows that there's a lot of value in those interventions and a lot of thinking about how the value is in the long term, but not as much is really talked about in terms of the short-term value. And I think that that's real critical to supporting your sustainability efforts with state Medicaid agencies. Therefore, we were really thrilled. It felt like a really great partnership. My word today is I'm feeling proud, because I feel like something we worked on a long time ago, starting in 2015, is now sort of reaching a little bit more of the prime time and just more easily accessible. And one of the things that we were initially brought in to do is to really work with the national office and some affiliates, notably in South Carolina and Colorado, to develop an approach to quantify and communicate to state Medicaid agencies the value of HealthySteps. Our partnership approach included, we went on site, we visited sites to really see what HealthySteps specialists do and identify the interventions that are delivered by the specialists that drive that short-term medical cost savings, in particular, and Medicaid cost savings. We helped, present demographic data to state Medicaid agency staff that talked about the breadth of and the number and demographics of the family you serve and the types of needs that can be addressed through the HealthySteps program and by the HealthySteps specialists. We looked at ways to determine the potential to enroll HealthySteps families into other programs. HealthySteps filled a gap for low-income families who don't qualify for other programs, and really working with state partners to analyze options for continued funding. So thinking through all of the different options and helping to kind of package that together for them. So some early results, and we hope to always continuously add to this list, and this isn't certainly the final list, but Colorado did dedicate general fund dollars in the governor's budget for HealthySteps. South Carolina Medicaid evaluated the option to approve a set of codes that the HealthySteps specialists can bill for regardless of their credentials. And really a part of this is really creating this Microsoft Excel-based ROI model, which is what it was back in 2015, and quite frankly, what it was until today, that we've been updating based on what are the needs in different states, and also how we can adapt that to different states and how we can think about new interventions as well. So I'm going to turn it over to Quinn, who can demo the ROI calculator, and happy to also answer any questions about the model development afterwards.
Thanks, Sharon. Hello, HealthySteps Network from Minneapolis, Minnesota. I'm Quinn Kaiser, and I have the pleasure, the privilege of walking you through the HealthySteps ROI calculator, our exclusive online return on investment calculator, created for you, the HealthySteps Network. So I'm going to go ahead and share my screen here. Hopefully you all can see this. Just our first landing page. So roi.healthysteps.org. It's live right now if you want to pull it up on your screen. This is where you'll go to log in. Right away, though, you will need to request an account. It's a pretty easy process to request that account. Let us know what site you're coming from, who you are, and that notification will come to our national office where we can take a look and make sure it's someone in our network, and someone we're working with, and kind of be notified of who that is, and go ahead and approve that request, which will then come back to your email, set you up with a temporary password, and then you can get yourself logged in to the ROI calculator where you can start entering some of your own data. Once you are logged into the ROI calculator, you'll land on a dashboard page like this. So some quick helpful tips, a little bit about the ROI calculator itself. Definitely check out the resources tab, and Elizabeth's going to run through that with us at the end of my demo, highlighting some of our resources there. But when you end up on this dashboard, really it's starting the calculator, and you'll jump right in to provide some overview data about your site, where you're from, how many sites this is applying to, the date range of the data you're going to be entering. And we'll keep going through this as well. I've got one ready to go already with some data in it. Pulled that up here. So this is for my COVID pediatrics, my 2020 data. I'm going to enter in my date here. I'm going to say this is for our, let's say 2020. It's going to let me know a year from there. So that's going to be how we're capturing our data. Anytime if you want to save changes, you can definitely go ahead and save them. Always a great idea. And then start jumping into our delivery costs as well. Your HealthySteps specialist salary and benefits, other direct costs for professional services, printing, publications, or some food for parent groups, mileage, annual cell phone costs, etc. A really great note here, I think, is the ability to add notes for yourself. Maybe you want to let us know this multiple specialists here. You've got the option to add a note there as well as you go through this overview data page. We're going to keep scrolling down. There's a second section then, a little bit more about your site, number of children 0 to 3 that you're serving during this 12-month data range, total children with Medicaid ages 0 to 3, and then breaking it down a little bit more as well for those total children ages 0 to 3 in tiers 2 and 3 served by the HealthySteps specialist within the 12-month date range. And a great note here as well is, as you see throughout the calculator, are some helpful tips. So maybe you're not fully sure what this might mean and looking for a little bit more information, you can hover over that helpful tip, and hopefully that'll help kind of guide you as you're looking for this data on your way through the calculator. So that's our first page, kind of we're setting our baseline for calculating our return on investment. Once you've got your baseline set up, you let us know, or let the calculator know, I guess, which interventions you provide at your site. We've broken it down into child-focused interventions provided by your HealthySteps specialists, or your caregiver-focused interventions provided by your HealthySteps specialists. And these are all toggle buttons here. You can toggle them on and off. Maybe you don't provide asthma services at your site. You can turn that off, turn it back on as you go through this to really highlight where you can find your cost-saving interventions. Again, the tooltips for each of these, a little bit more information about what we're looking at. If you're like me, though, I like to just jump right in, turn them all on, and just start seeing what else is on those pages. So once you get out of that overview data section, you can navigate between all these interventions on the left-hand side if you want to jump around and see what they say. Otherwise, the calculator itself will walk you through them kind of top to bottom, starting with the child interventions and working your way down through the caregiver interventions before you'll finally get to a section where you can view a report of your data and your calculation and your return on investment. So we'll start with oral health, and really each of these intervention pages is going to be set up pretty similarly. We're going to definitely give some more information at the top. You'll again see that toggle button. If you don't want to note that you're providing oral health, you can turn it off. Maybe you turn it off on the page before this and you want to turn it back on. You can do that there as well. So to start working our way through it, the number of caregivers who discussed a need for oral health services for their children with a HealthySteps specialist and were referred for services. The business case I was using, I think we had 200 here. And then you'll note that, all right, I've got to fill out what percentage of children had a first dental visit by age 3 due to our HealthySteps specialist support. It's going to be a range on each of these interventions. I'm not sure we do well on this one at our site. Let's put that from 15 to 30. And as you see while I'm moving these as well, our estimated cost savings is going to change as well, both on this intervention and in our total. I'm going to bump this up just a little bit. Again, you can save it up at the top, or if you're just ready to go to the next page, you can go ahead and click Save and Next. And that same pattern is going to repeat through all of these interventions. Intro, toggle, a little bit of a question here at the top for a number, and then our sliders of percentages. You can certainly type in percentages here as well. If you don't want to play with the slider, I think the sliders are fun, but if you're just want to enter data, you can just tab right through and enter your data. And also note as well, let's say you get a call, you got to go pick up your kiddo from school. You don't want to lose your work. You can save your changes at any point. Exit this. It'll take you out of the calculator, log off. You can definitely come back in. At another point, you'll see that this calculation that I'm working on is in progress. I can either click on the name to jump back into it when I'm ready, or on this ellipses as well. If I want to delete this out or continue editing my data, I can go back in as well. So don't feel like you've got to sit down all at once and work through it. Or maybe it's a data point that you don't know the answer to, you want to talk to somebody else on your team, or you want to send them this link so that they can work on it with you. Definitely don't feel like you've got to sit there through one session to complete all this data as well. So I'll work back through this. I think we're up to asthma. Keep clicking my way through these interventions. Again, same pattern, filling out our numbers. We've got our sliders as well for our appropriate use of care. Here, talking about the number of caregivers who contacted HealthySteps specialists seeking advice about whether to bring a sick child in for a visit. In our business case, we put 30. Talk about our percentages again and see our calculation growing here at the bottom as well. It's really going to just continue like that through the calculator. Maybe you want to turn some of these off as you get there and you read a little bit more and decide. We don't really discuss the benefits of immunizations at our site. Feel free to turn it off at that point as well. Definitely not an issue. You can turn it off, save it, exit, and keep on working your way through the calculation for your site. Again, there's nothing really blocking you from jumping down into the caregiver interventions as you work your way through it. So I'll jump into there. We've got our postpartum maternal depression, healthy birth spacing, intimate partner violence, breastfeeding, and smoking cessation. Again, same pattern, might get a couple more questions depending on the intervention itself. But then I'm actually going to skip down to the end just for some time here on this webinar as well. Certainly take your time while you're working through it. I've got a couple key spots that I want to highlight before I'm out of time. So when you do get to the end, or at any point, if you get your appropriate use of care and you want to see your report, then we've got this button up here at the top to view your report. If you do go through it chronologically and get to smoking cessation, you can save and view report here at the end. So let's go ahead and take a look at that report. At this point, we can see a little bit of a recap of the information we provided. It gives us that nice, for every $1 invested in HealthySteps, here's our estimated dollars in savings, a percentage of that overall Medicaid ROI, a nice breakdown, nice takeaway here at this point. If you want to see a nice breakdown by intervention, we've got that here for you as well. And then the final page of that report is really a recap of all the data you put in there. So this is all the interventions, all the questions we've asked. I'm going to zoom in a little bit, just a little small here, a lot going on for all the data points you're entering in. But this is a great takeaway. In the end, you're going to submit this for review. And what you're doing is you're submitting it back to the HealthySteps national office. When you do submit your calculation for review, again, you can go back and edit it if you want to keep playing around with your data. But when you are ready, you can go ahead and submit that for review. We'll ask you, are you sure you want to do this? Because once submitted, it's going to come to us, it's going to kind of lock that data down from your editing it. And why we're locking it down is Elizabeth or somebody else from the HealthySteps national office, they're going to get a copy of what you put in here. We're going to review that, make sure it lines up, make sure like, oh, you actually said you serve a billion children 0 to 3. Like, let's maybe make sure that that's correct. We've got your information from when you filled out your account. We'll reach out, we'll kind of maybe schedule a call, talk through this a little bit. And we kind of want to certify and sign off on your data. So I'm going to go ahead here. I feel good about my data. I'm going to submit this one for review. And now you can see that that one is under review by our HealthySteps National Office. I'm just going to pull up an admin page here on my other screen. So you can see that that's going to come in for Elizabeth to review. And I'm going to go ahead and actually, Elizabeth can download that and we can mark this one. Either, you know what, we got to edit that billion children served. We got to bring that back down to our 1,600 kids served. Move it back in progress. In this case, let's go ahead and say that this one, data looks great. We want to keep talking about it. Let's send it back to you. So we're going to finish that one. Go back to my user screen here. We'll let you know. We'll reach out and say, hey, your data looks awesome. Let's keep this going. Let's talk about our next steps with what we're going to do with this takeaway. So refresh here and you can see that that report's finished. Now you've got the option to actually download it. So you're going to get a PDF download that'll pop up here for me of that report page where you can take this and kind of run with it and really highlight your return on investment. Or if you just want to take it and keep this data page for any other work you're doing, that's on there as well. But that's pretty handy to have that PDF available to you once we at the national office get a chance to review that data. So I'm actually going to pull Elizabeth in now at this point to talk a little bit more about the beginning points. When we landed on this as a first-time user, we recommend checking out that resources page. So I'm going to go ahead and click on our resources page here. So we've broken it down before your ROI calculation and after your ROI calculation, different files here that you can download. And I will turn to Elizabeth to talk us through these.
Thanks, Quinn. Hi, everybody. So I'm Elizabeth Fournette, and I'm coming to you from Cambridge, Massachusetts today. And Quinn, thank you so much for walking through that. That was fun to see, as always, for the billionth time. But also I wanted to reiterate one point you were making about the review process for our national office. Part of why we want to review that too is just we want to verify all the data. We've done this with various partners over time, and we just kind of want to do some gut checks, but then also we want to make sure that before it's verified, like we don't want you to share it externally until we've really talked it through and thought about it together. So yeah. But then in terms of these resources, so you can see here that supporting materials listed on this resources page are separated into two major categories. The first is materials that can help you support your team prior to inputting your data into the ROI calculator, as well as materials that you can review after you submit your inputs to our national office. And then really as you prepare to share your analysis with key stakeholders. In terms of, I just want to walk through like each of them. In terms of the materials to review prior to using your ROI calculator, the first is the FAQ. And this can really help understand the steps needed to create your customized HealthySteps business case. And again, the business case is broader than this ROI calculator. The ROI calculator is one piece and it's a tool, but this is a broader package to really articulate the value of your program to key stakeholders. So this FAQ provides information and steps you can take before, during, after you complete your ROI calculator. Then the next resource is a test report, and that's what Quinn was just walking you through. And it's really an example of what your report could look like. And it includes all the data inputs needed for the ROI calculator. So for example, if you're wondering like, what are the data that we need for this ROI calculator? Page 2 right there where Quinn has it, you can literally copy and paste into whatever sort of data tracking tool you like. The next resource is called Early Childhood Behavioral Health Integration Activities and HealthySteps, Sustaining Practice and Averting Costs. And actually one of our panelists here today, Melissa Buchholz, she co-wrote this with other colleagues in Colorado. So would love you all to take a peek at that. It's brilliant, unsurprisingly. So thank you, Melissa. Then the next resource is the HealthySteps ROI data collection tool. So this is a tool that you can use to collect the data that you input into the ROI calculator. And it's by no means necessary for you to use this tool in particular, but we wanted to offer this to you as an option if it's helpful for you. So now the materials to review after you generate a certified HealthySteps report. And what that means is you submit your report to our national office. We kind of have our back and forth process and discuss your inputs. And then we hit final and you have a certified report that you can share out with your stakeholders. So at this point, you can create, the first thing is the HealthySteps business case PowerPoint. So it's a template. We created it to support you, and it includes speaker notes, additional information that you can include in your presentation. And it's really geared for your state Medicaid agency. But although that was the original intention, it can certainly be adopted for other audiences, including insurers, health system leadership, kind of whoever you really want to make this case to. The next resource is just a simple checklist. So it's a quick kind of checklist of helpful tips to consider prior to presenting your business case to your state Medicaid agency. And then the final resource is questions to anticipate from Medicaid. So this is a Q&A document that we made that really shares the questions state Medicaid agencies have asked us in the past, and also some proposed responses to really support you. So those are all the additional materials, and I'm available for any questions about the content, utility, value of the ROI calculator. What's cool and special about this tool is that we can continue developing it. We can make it better all the time. So we really look to you all, our network, to tell us like, this is helpful, I don't understand this, and we can just make that change. It might take a bit, but it's a very exciting process. So please participate fully with us. Okay, so now I want to turn to our panelists. Sarah, first to you. So you and your team have actually tested out this new online version of the ROI calculator. Can you tell us a little bit about your experience and really how you'd like to use your results?
Yeah, absolutely. Thank you so much, Elizabeth. We were so grateful to have a sneak peek at this ROI calculator and found it really so easy and straightforward to use. It didn't take a lot of time, and most of the data we were able to pull right out of our annual site reporting and our annual budget for the last fiscal year. I also really appreciated that it allowed us the flexibility to account for each of our sites' uniqueness. We were able to look at each of our 2 sites individually. We looked at them together, and it also allowed us to focus on those areas where we know we do a lot of work and put a lot of our time and energy into. For example, at our sites at Rady Children's, we support a lot of parents through mental health concerns, lactation questions, but not very often with asthma, because our practices have a really strong, long-standing clinical pathway for it. So we were able to toggle those off for asthma and toggle the mental health and the lactation on and look at those. We're in the process now of building out some additions to our HealthySteps database so that we can better capture those conversations that we know our specialists are having with families, so that then we're more able to more reliably and accurately capture those in the ROI calculator in future iterations. To answer your question about how we plan to use the data, in a few different ways. I think it's going to be so valuable for us to tell our story and advocate with First Five Riverside, who funds our work at Rady Children's, but also as we work towards sustainability and expansion. So with the state Medicaid programs, with private donors, and even within our own organization, as we want to share our good work and what we're doing. I would say I'm most excited probably to share with our pediatricians in our practice. We know that they know the impact of our work and how important it is that we're there, but this is really going to quantify it for them. So I look forward to being able to share our results with the pediatricians in our practices as well. Overall, I would say absolutely recommend giving it a try. I think it's so beneficial in supporting the longevity of our work. I found the supplemental documents that you just kind of reviewed, Elizabeth, really helpful, and we're working through those now so that we'll be able to really present our case to our different stakeholders. So thank you so much for the opportunity.
Great. Well, thank you, Sarah, so much for sharing and also agreeing to really be a test case for Quinn and I. It's been so helpful to get your feedback all along the way. And especially, I think that your view is going to help other HealthySteps specialists in the network really understand it and utilize it well. So thank you. Melissa, can you tell us about how you've used results from the ROI calculator? Obviously, the kind of previous version Sharon was talking about. Really articulate the value of HealthySteps in Colorado, specifically to key stakeholders. What were some of the outcomes of that work, if you don't mind sharing?
Sure. So as was mentioned earlier, we were one of the states that lost federal funding in 2015 that was supporting HealthySteps, but we're really committed to sustaining the 7 sites that we had at that point in Colorado. We were serving thousands of children, and neither our sites nor our state partners wanted to lose those critical services. So we were beyond thrilled when 0 to 3 came to us at the very beginning of the development of this business case. And what we've done is use the lessons learned from that work with 0 to 3 and Manat to reach out to several state agencies, including Medicaid, but also including our Human Services Agency, Department of Public Health, members of the state legislature, local and regional entities, and philanthropy to demonstrate the opportunities that HealthySteps creates to reduce the total cost of care for children and families. So it's been beyond incredible and helpful for us to have this really concrete data, which includes an average return on investment, as well as some specific ROI data from some of our larger sites in Colorado, which the paper that you mentioned earlier looks at one site in particular. And we've used these data to demonstrate and advocate for the financial value that HealthySteps offers. We've used these data often to advocate for funding at the state, local, and system level for HealthySteps implementation and sustainability. And it was especially valuable and successful in advocating for HealthySteps to be included in the state budget. As you mentioned earlier, our governor decided to include a line item for HealthySteps so that we could continue to support those 7 sites as a state, and have since almost tripled our footprint, which is pretty incredible. So we worked closely with several local philanthropy partners who have also invested in HealthySteps expansion across Colorado, and the ROI calculator has really helped us to convince and explain the value of HealthySteps to people who aren't as familiar with the model as we are. We feel like we're just at the beginning of this work. So we have big dreams for HealthySteps expansion in Colorado. And I know that this tool will continue to be invaluable to us in our advocacy work across all levels, state level, certainly with Medicaid, and definitely with our local partners as well.
That's wonderful. Thank you so much for sharing, Melissa. We really appreciate all your work on this. Deanne, how about you? Our national office partnered with you and your HealthySteps colleagues in Arizona to really conduct a full statewide ROI analysis, and then took that analysis to your state Medicaid agency, which in Arizona is called Access. Could you tell us a little bit more about that process? Oh, there she is.
Elizabeth, this is Deanna. Are you talking to me? I had a disconnect.
Yes, of course. So Deanne, I was just asking you, would you mind telling us a little bit about your process with the full ROI statewide kind of project that we did?
I'd be happy to. Thank you for asking. So and I'm sorry if there's noise in the background. I'm in a park, a city park, so it's the best we have today. HealthySteps in Arizona is over 22 years old. And so we have expanded HealthySteps throughout the state with the support of many stakeholders, and most currently our state early child agency, First Things First. So hello to my colleagues that are on this call. I saw your names pop up. And I wanted to kind of give you an overview of the activity we have partnered with so many to undergo up to date. And one of those things was that we had the state board from First Things First come out and visit and host a board meeting of theirs in our rural community in Sholo, Arizona. And as a result of that, a new board member connected me with the state president for one of our Medicaid programs and said, hey, you know, insurance should maybe be covering this. And it's just such a great bargain. And so we began that work, and she made sure that I had a meeting with him, and I sat down and I went through what is HealthySteps and why do you need us? And what have we been doing for you over all of these years and your children and families? And he was pretty blown away. And from there, I received the support of the 0 to 3 team, and we worked together to develop the ROI return on investment for Arizona specific sites. And that data has allowed us to create a presentation and submit it for presentation at the annual First Things First Summit, where all stakeholders across the state join once a year to hear about programming and hear about new approaches and hear about research and all kinds of great material. And the 0 to 3 team again joined me in that presentation, and we invited a lot of Medicaid folks throughout the state and a lot of other philanthropists and stakeholders in early childhood. And it was a wonderful presentation, and it was well received. From there, we joined together in partnership. I think our partnership solidified from that presentation with a number of partners, including First Things First and 0 to 3. And we were able to get a meeting with the state Medicaid director and her staff. And we presented the model, we presented the ROI, and it was just so awesome to be able to do that, because for so many years, you know, they would ask us, well, what's your ROI? And we're like, well, we don't know. And we do now know. So that's a huge step. And they actually see how effective it is to invest early on. And they see the outcome of that investment early on. And that's quite attractive to people. So today, with everything going on in our world, the work has taken a pause. However, people have been assigned by the agency director to find out more data, to maybe identify a pathway for us to receive some reimbursement work. So that's where we are today.
Thank you so much, Deanne. I so appreciate your insight and feedback, and it's been just such a pleasure to work with you. So audience, now I wanted to really turn to you. You all have any questions for the panelists about what they've shared, thoughts you have, initial reactions, and as a reminder, please feel free to post your questions by either using that little Q&A feature at the bottom of your screen or the chat box. Both work, and then we can repeat your question out loud so that everyone can hear, but would love to hear from you all. And while those questions are coming in, Sharon, I didn't know if you wanted to, it looks like we got one Q&A from Cherie, and she's asking, how could state funders pull together multiple agency data within their state, as some states would need to do this to be a collaborative approach versus individual organizations going to Medicaid kind of separately? So how could you really pull together multiple agency data to come as kind of a group?
Well, I think it's probably different by state. Not surprisingly, that data is never easy to access. And in fact, it's even hard for, as we all know, it's even hard for within a state the state agencies to access each other's data and make meaningful use over it. So I think, unfortunately, there's no real easy way to do it. And in most states that I'm aware of, you really do have to go to agencies separately. However, there are collaborative efforts out there, right, to share that data better. And even if you don't have the panacea and data that you want, I do think that some of the findings that you can pull together that are sort of less quantifiable and in an ROI model are still part of the broader business case and still really apply. So for example, if you can say something like, I'm interacting with this number of families and this number of children, and we're identifying this number of needs, and you're able to even get to that level of data and this, you know, this number of maybe early education needs, or this number of folks that we're referring to food services and things of that nature, that generally, even that sort of level of data is pretty compelling, even if you can't put all of that in an ROI model and show a savings to that. A lot of times in the other programs, it's really about showing you're able to engage the families at the point of time that you're a trusted advisor to them, that you've got some sense of how many folks you're engaging, and you're able to even just connect that person to another state-sponsored service, and that's fairly valuable.
Thank you, Sharon. Another question that is coming in is, thanks so much, this is very helpful. If I'm understanding correctly, this is all estimating overall cost saving to the state. Is there any info on ROI at the provider institutional level? Great question, and your assumptions are right. So this is really an overall cost savings to the state Medicaid agency. So the ROI at the provider institutional level is different and is not what this calculator does, but is of course important. And I think that we can articulate that using some anecdotal data, such as like provider time saved by including HealthySteps and things of that nature. But that's a great question. And no, this ROI calculator is specifically for state Medicaid agencies. So thank you for asking.
And Elizabeth, I'll just quickly add, you know, we had worked with Sharon and the Manat team to try to figure out if we could do something at the health system or provider level. And I think when it came down to it, there are just so many differences from state to state between health systems and providers, and a lot of intricacies that I think the greatest commonality that we could find was really at the state Medicaid agency level. But rest assured, we continue to think about that. And we have seen instances where the ROI savings have been shared with health system leadership to give them insights, I think as Elizabeth had mentioned before, into the types of value that HealthySteps are adding to the institution itself, or you know, to making referrals internally. I think there's so many wonderful pieces of information that could be shared with your health system, even though this is geared ultimately towards state Medicaid agencies.
Thank you, Jen. And then another question in the chat is really around data. So how are you calculating these data? How are these estimates generated? What are the data kind of needed for the ROI calculator? Those are awesome questions. So basically, cost savings should ideally be generated after a HealthySteps program has been in operation for at least a year. The reason for this is so that HealthySteps specialists are really able to build their caseloads to full capacity. And the data for HealthySteps business case can be collected in kind of a variety of ways. There's a lot of flexibility there. One, electronic health records for sure. But also that's not the only way. So you can use that HealthySteps ROI data collection tool that we mentioned before and Quinn kind of pulled up. That's on the resources tab. You can use Welly, if any of you are familiar with that tool that our national office has provided. And you can also simply use periodic kind of surveys of HealthySteps specialists. Then the data can be collected either concurrently with implementation, or, you know, for a set amount of time, like 6 months or a year, or you can also really estimate it retrospectively. And the key point is that all the cost data and all the intervention data need to be within the same 12-month period. And then some, you know, major buckets of data needed are like HealthySteps cost, service delivery costs, the number of children served by tier and health coverage, because again, this is specifically for kids with Medicaid. And information on how often HealthySteps specialists support families with each of the interventions that Quinn mentioned. So the flu vaccine, oral health, appropriate use of care for ambulatory sensitive conditions, asthma, breastfeeding, postpartum maternal depression, healthy birth spacing, intimate partner violence, and smoking cessation. So I hope that answers your question, but if not, feel free to articulate it further. Other questions? Other questions for any of the panelists too? And if not, we can really open the floor for more general questions about the tool. And I wanted to thank folks who actually submitted some questions prior, just in terms of signing up for this webinar. So I want to take a few minutes to answer those now. And the first one we received was recommendations for clinics that don't want to bill for HealthySteps services or can't bill for HealthySteps services. And that's a great one. And I think that the ROI calculator is an excellent tool for sites like that. So it's a great way to demonstrate the value for clinics that don't bill for HealthySteps services. And the analysis may even help you to convey the full breadth of services that you provide, which can actually then really lead to potential new sustainability avenues or even opportunities for billing that you hadn't considered. So great question there. Another question we got previously was some trouble getting information from the practice that would allow a more complete data set. And this is certainly a common difficulty that we've heard from the network. So we hear you. And what's great about this tool is you can use estimates. So that should be fine. And a really neat feature that Quinn showed you kind of quickly was that you can make notes while using the ROI calculator. So you can say, you know, this particular input is based on blah, 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 blah. And then we have that information and then can continue to consider whether or not that might be appropriate for that specific piece. And the data is based on interventions provided by the HealthySteps specialists, and that really provides a robust opportunity for infusing some real life experiences into the estimates. Another question we got was, does the ROI calculator provide analytics of cost savings over multiple children over time? Fabulous question. And the answer is it's sort of it's a snapshot, and it's really a short-term picture of cost savings for children in the practice with Medicaid coverage. And yes, these savings are annualized. It can be assumed over time. But what's also awesome about this tool is you could do this tool, fill this tool out for calendar year 2020, and then think, oh, well, you know, now our HealthySteps specialists are actually doing more smoking cessation interventions. So maybe we should do this ROI calculator again for 2021 and kind of see how they compare. And that is awesome. And you can do that like right now with the ROI tool. So great question there. Any other questions coming in? Oh, Kristen, thank you. So we struggle with needing licensed providers for reimbursement, which might help MCP fund, but having easier time hiring for diversity, including Spanish language, with bachelor's and master's prepared unlicensed. What do others do? Oh, so this is kind of a question for everybody. And anyone on the panelists, at least, do you have thoughts about this question?
I can jump in, Elizabeth. We definitely struggle with that, especially in our rural communities in Colorado, just with workforce shortages. Well, there's workforce shortages everywhere right now, but especially in our rural communities. And so have providers in some of those communities that are unlicensed or license eligible, but not licensed yet. And I think this tool, as Elizabeth mentioned, can really help demonstrate the value add, even when there's not reimbursement opportunities within the fee-for-service landscape. So I think the trick for us in Colorado has been convincing our Medicaid agency, as well as our other state agencies that I mentioned, to invest in this model, especially when there's a value add, but not a direct pathway to bill for those services. So for example, for us, we really highlight how the return on investment or the impact of HealthySteps overlaps with the state's key performance indicators that our regional Medicaid entities have to demonstrate to our state Medicaid. And, you know, we're still doing that work, and we'll continue to do that, but that's helpful to sort of think more bigger picture about what's the broader return, and how we all know that HealthySteps doesn't fit. It's a round peg in the square hole that is fee for service. So I think the calculator really helps to demonstrate the value beyond fee for service.
Thank you so much, Melissa. Your insight is so appreciated.
So with that, I will close this out since we're almost at time. I just wanted to thank everyone for participating today, and especially our panelists, and obviously Elizabeth and Quinn for all of their hard work. And thank you, Sharon, for joining. It truly has been a pleasure to hear from you all. We're grateful for your questions and your engagement, and we know there's more to come. So please don't be shy. We have included in the chat a link to the new HealthySteps ROI Calculator for you to explore. So please, please don't be intimidated. Go in, use it. You know, you can tinker with it. You don't have to submit your results until you're ready. So please don't be intimidated. Use the resources. And we will also be offering office hours next month as a chance for you to ask questions with us in a live format. So please keep a lookout for that and mark your calendars when those dates come across. And finally, we do have a short survey for you all to complete about today's webinar. So we would really appreciate your feedback. And just in closing, we are grateful to all of you for being a part of our HealthySteps network. We know the work that you do every day is so important. And this ROI calculator captures like a sliver of that. So I don't want any of you to sort of look at the interventions and think, wow, I do so much more. We know that. And hopefully this is just a start of getting everyone thinking about the value that you do add. So please feel free, check out the new online ROI calculator that's available. You can begin using it right now. And if you have any questions, please feel free to reach out to us. You can reach us at HealthySteps@0to3.org. And thank you again.
Thank you, everybody.
All right, bye-bye.